Hello everyone, this is Dr. Shushma Sarala, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss about a topic which affects most of the population and globally. That is nothing but hair fall. It is of most concern. So we are going to discuss and do series of hair falls, gender based, and also series of hair falls which are based on certain medication problems and also on certain causes. So let's dive into the topic. Today's topic is hair fall on females. So what is hair fall? Hair fall in medical language is called as alopecia. It can occur either in the scalp or anywhere in the body, and that whole terminology is called as alopecia. It has different names for it. Hair loss is called alopecia. It can be partial or complete. Partial means it can have, it can occur either on the scalp or either on the body, only patchy loss of hair. All of this is considered as partial. If it is complete, that means there is no hair on the body. Okay, and it can occur anywhere in the body, but mostly it will occur on the scalp for majority of the population. Now let's get into the signs and symptoms of hair fall. As you can see in the picture, see, there is receding hairline and also there is widening of the hair. What is widening? That is in the temple part you will be having hair fall. So let's go deep into each sign and symptom with the picture so that you can get a better idea of it. Now we will know the signs and symptoms in detail. As you can see in the picture here, see, you can see that the hairline is receding. It is until here and it starts to recede. Okay, you can see that the hairline started here, it has started to recede back, and also there is widening, that is this part, especially the temple part of the scalp, there is hair fall and they start to cover it with the little small hairs that we develop. So there is a widening here and also receding hair. So receding hair is usually seen in male pattern baldness, but in certain section of people who have tight ponytails or who do pulling of the hair, there will be receding of the hairline. And also widening part of hairline is common in female pattern baldness. Now as you can see in the picture, see, is there any healthiness added to this hair? The hair is very dry, the hair is very brittle, and it has broken in the middle itself. So you cannot say that the hair is not in full length, and also you can say broken hairs here and there. You can see that the hair is very dry, brittle and lifeless. See, when you are starting to experience hair fall, you will have symptoms like these. And if you have a lot of scaling of the scalp, that is in conditions like seborrheic dermatitis, or if you are suffering from yeast or fungal infection of the scalp, if you are having too much of psoriasis attack or scalp psoriasis, in all of these there will be severe scalp scaling, which can lead into this reddy, itchy flakes, and also can be associated with the hair fall, and it can also make your hair having patchy hair loss. As you can see, this patch, there is very little hair compared to the other parts of the scalp. So there is patchy hair loss also. Now we'll see the next sign and symptom. As you can see in the picture here, there is hair fall in the vertex area, that is on top of the head. And also you can see that if you start to make sections of the hair, you will see that there is increased or widening of the scalp in the section. That is also a symptom of hair fall. Now let us get into the investigations part. See, if you're experiencing hair fall, how do you even know that if you're experiencing hair fall? When you comb your hair every day in the morning or at night, and if you see that, see, it is not when you're oiling your hair. When you oil your hair, you tend to have a little bit more amount of hair fall compared to the normal, when you're combing your normal hair. So when you're combing your hair normally without any oil, and if you find that and you count the number of strands that is more than 100 or 120, that means you are experiencing hair fall. So let us know what are the investigations that need to be done. For example, if you are suffering from hair fall and you're going to a doctor, the primary thing will be physical examination. So what do you mean by physical examination? There are certain tests that need to be done in order to know if you're having or experiencing hair fall. First, we'll see into the pictures and let you know what sort of investigations they are. See, this is called as the pull test. What do you mean by pull test? Here, the doctor is taking a section of the hair and then they are pulling it. When they are pulling it, if there is more than 10% of hair fall, from that section, that means you are experiencing hair fall. So this pull test they will be doing all over the scalp, and if you are experiencing 10% of hair fall, it comes under hair fall issue. The second test is called as the tug test. So what is tug test? Here they are taking a section of hair and they're placing the section of hair here and they'll start to pull from here. This is called as a tug test. If you're having visible, brittle and also thin hair, here in the tug test you will feel, or the doctor will see, that the hair, when they're starting to tug and pull it, it will come off. That is, the broken hair will come off. That means your hair is not healthy in nature. Apart from these two physical examination tests, we have other investigations which are also very important in monitoring your hair fall. First thing being the blood test. So why do you need a blood test for hair fall is that certain levels, like for example iron deficiency anemia, folate deficiency, or if you're having B12 deficiency, vitamin D deficiency, A deficiency, or hypervitaminosis of vitamin A can also lead into hair fall. So by doing the blood test, we will know if there is any underlying cause. Even in certain liver problems also, and also in kidney problems, you will be experiencing hair fall. To know all of this, we will be doing a blood test. And then the skin biopsy. The certain section of the skin or this on the scalp is taken and there will be viewed under the microscope. As you can see here, in skin biopsy, we will know in detail what is happening to the hair, and in light microscopy, see, as you can see, you'll be understanding the hair shaft and also what is the problem with the hair. Visibly, you can zoom in the microscope and understand where the problem is or what is the texture of the hair in detail. So these are some investigations you need to do if you're suffering from hair fall. Now let us get into the structure and function of the hair. So by knowing the structure and function of the hair, we will know where the problem is occurring and how we can prevent it, or we can cure it, or we can have a relief of this hair fall symptoms. So as you can see in the picture, this is the dermis level, and in the dermis level you will be having the root of the hair, and this is called the shaft of the hair, which will be penetrated through the epidermis layer, and this is the dermis layer. So in the dermis layer, what you can see a sebaceous gland, first thing. Second thing, you can see blood vessels, right? So if you are having any sort of problem in the quality of the blood, that can be iron deficiency, vitamin B12 deficiency, all of this will reflect in the blood supply to the hair. If you are having a poor quality of blood, by improper supply, I don't mean that there will be no blood supply to the hair follicle as such, but I'm telling you, because there is low quantity of, or decreased quality of the blood, there will be not much nutrition going to the hair follicle as such. And also this part is called the bulb of the hair, and then this shaft, it has two things. See, you can see the outer one is called as cuticle part, the cortex part, and the medullary part. Okay, and the cuticle, all of this is made up of the keratin protein. So protein intake is also very important in hair fall issues. Okay, so many people feel that hair is for aesthetic purposes. Remember that the reason why we have hair on the scalp or anywhere on the body is for thermoregulation. That is to maintain a certain body temperature, which is necessary for the bodily functions. And also, not only that, the scalp hair protects the scalp as such from direct sun. Okay, if you're going out in the direct sun, if you're having hair fall, you will feel that there is a little bit of more heat generated. So in order to regulate the body, we have scalp hair or hair anywhere on the body, and also to protect the scalp from direct sun, we have this hair. So here today we are discussing about scalp hair fall, especially in women. Now let us get into the causes and risk factors for female hair fall, especially on the scalp. As you can see, the first and foremost thing is genetics. If your mother or your father or your grandmother or your grandparents are suffering from severe sort of hair fall, then you can also experience this hair fall. But there are certain things that you can do, if you're having a genetic history, that is taking good diet and also lifestyle improvement can delay this process. Next thing, hormonal changes. So what sort of hormonal changes will cause this female scalp hair fall? First and foremost, if you're getting pregnant, then that can cause hormonal fluctuation leading into hair fall. Second thing, what will happen is during lactation, many women have hair fall issue, especially during the lactation phase. So if you are lactating women, then you will be having this hair fall, but there will be regain, that is the hair follicles will start again to grow after the lactation period if you are taking proper diet as well as medication. Next, coming to the hormonal changes, we have the main problem, especially in the teenagers, in the working women sector, that is PCOD. If you are suffering from PCOS or PCOD, you will be having hyperandrogenism, that is a little bit more amount of testosterone and also a little bit of more amount of estrogen, which can cause hair fall and also unwanted hair growth on the body parts, whereas there is hair fall on the scalp. Okay, that is also a problem with the hormonal issues, especially. And other thing that people are suffering, if they are not suffering from PCOS, pregnancy or lactation, is the thyroid issue. Any fluctuation in the thyroid gland functioning, that is, it can be hyperthyroidism or it can be hypothyroidism, can lead into hair fall issues. Next is the medical condition. So what sort of medical conditions will lead into the hair fall issue? See, the primary medical condition that will lead into the hair fall issue is iron deficiency anemia or folate deficiency, zinc deficiency, selenium deficiency, or if you're having megaloblastic anemia, that is vitamin B12 deficiency. All of these deficiencies along with vitamin D deficiency. So vitamin D deficiency is also very important. If you're not getting enough of sun exposure, that can lead into vitamin D deficiency, which can lead into hair fall. All of these other deficiency, as I told you, can also lead into the hair fall. What are the other medical conditions? The other medical conditions like fatty liver. If you are experiencing grade 2 or grade 3 fatty liver, that can also cause hair fall. If you are experiencing obesity with hypertension, that can also lead into hair fall. If you are experiencing diabetes, that can also lead into hair fall. So please do check if you have any of these issues. Next, medications. Medication especially which is related to the arthritis, that is the joint medications. If you are taking a lot of painkillers or if you're taking a lot of medication for your pain, especially the arthritis condition, those medications have a tendency to cause hair fall. And also if you're taking medications for your hypertension, that is BP, that can also cause hair fall. Okay, and also if you're taking hormonal pills for PCOS or for PCOD or for any other female reproductive system disorders, that can also cause hair fall in a larger sector of people. Other causes, the main one, the primary one that you have to remember is stress. Stress is the main cause for hormonal fluctuation, and from the hormonal fluctuation you will be having hair fall. So if you are experiencing hair fall, you will again start to stress out. That is like a cycle. So if you are maintaining stress continuously, if you are having stress continuously and you are not doing anything to let go of that stress, it will cause hair fall. So make sure that you do not have stress. And also people who are experiencing acute illness, like if you are experiencing dengue or after malaria or after any sort of typhoid or COVID-19 symptoms or any flu symptoms, if they have sudden hair fall, then that is also coming under these other causes, which is called as telogen effluvium. We will discuss about this in detail in the next video. Next, coming into the body changes. So what happens in the hair so that we are experiencing this sort of hair fall? What are the changes? Look deep into it. See, as you can see here in the picture, first thing that you need to note is the blood supply. If you are having poor quality of blood, which means deficiency in magnesium, deficiency in selenium, deficiency in zinc, iron deficiency, folate deficiency, vitamin B12 deficiency, and also vitamin D deficiency, because that helps in overall build up in the body. All of this deficiency will have poor blood quality, so there is no enough of nutrition for the hair. And also low protein, especially vegetarians who are not consuming enough of protein, can also lead into hair fall because there is no proper nutrition going into the hair. And once you start taking good amount of protein, good amount of all of these micro elements, hair will start to grow. Just like menstrual cycle, the hair will also have cycle. It has 3 phases, but for your understanding, I will cut it short into 2 phases. The first phase is called as the growth phase, which takes 2 to 8 years. Okay, and the second phase is called regression phase. We're not talking much about it because it does not have a lot of impact. But the third phase is called as the falling phase. We are talking about the growth phase and the falling phase. Remember, in the growth phase, what happens is that the hair bulb, it will start to expand, the hair will start to grow in thickness and also in the length. Each hair follicle I'm talking about. So it will take about 2 to 8 years. and after that 2 to 3 months the hair will be in the regress state, that is where there is no growing, there is no falling. There is a third stage which is called as the falling stage, where the hair bud from the root it is taken away and then new hair will start developing. What happens is that if there is any sort of hormonal imbalance, or if there is any sort of poor blood quality, or if you are experiencing any other problems as I mentioned in the causes and the risk factors, what happens is that this bulb and this hair shaft after falling off, there is no new hair, and also the growth phase which should be for 2 to 8 years is also decreased. So it is at least just 1.5 year or 1 year of hair growth will be there. So there is usually, in if you examine the scalp of a healthy individual, 80% should be in the growing phase, 5 to 10% should be in the regression phase, and other 5 to 10% should be in the falling phase. But because of these changes on the risk factors, the whole criteria is disrupted, where 40% or 20% there is a rise in the hair fall or the falling phase, and there is decrease in the growth phase. So if this cycle is disrupted because of any of the causes and the risk factors, there is hair fall issue. Now coming into the conventional form of treatment, or you can also call as allopathic form of treatment, and you're finding these forms of treatment even in aesthetic clinics right now. The first one that they do is giving minoxidil, so that it helps in better growth of hair. Second one is anti-androgen tablets. Why are they giving this anti-androgen tablets? If you are experiencing PCOS or PCOD or any sort of problems where there is hyperandrogenism, they will give again hormonal tablets to suppress this androgen problems. What is this platelet rich plasma therapy? You will draw your own blood and they will have microneedling done, which is there is an instrument which has small spikes on it and they will roll it, okay, and they will infuse this plasma rich plasm into the scalp, or they can directly inject it as well. And there is low level laser therapy, where through the laser they will be stimulating the hair growth, and also there is hair transplant if there is like complete baldness. Remember, in the conventional form of treatment, if you are using minoxidil or if you are using anti-androgen tablets, they are not going to work for a longer period of time. If you are combining two systems, like if you can combine homeopathy along with certain medications like low level laser therapy or platelet rich plasma, you can see better results. If you are suffering from PCOS, or if you are suffering from hormonal problems, if you are suffering from stress, you can take homeopathic medications which work really better for hair fall, and then you can combine it with the aesthetic medicines like low level laser therapy or PRP for better results. But remember, all of these will have a result, which can stay for 2 to 3 months. If you are experiencing hormonal problem, better take homeopathic medication and then go for the other treatments to stimulate your scalp. Coming to the homeopathic form of treatment, is there really a medicine for hair fall in homeopathy? See, remember that if you are having any genetic history of hair fall, there is nothing we can do, because you can only through diet and lifestyle you can monitor it so that you will not experience it. It doesn't mean that everyone in the family, if they're experiencing hair fall, you will also experience it. It's just a risk factor. If you're having an unhealthy lifestyle, if you're having a lot of stress, you will experience hair fall. But if you're monitoring your life properly, then maybe you will not even have a episode of hair fall. Especially in the genetic cases, we cannot do much about it. But in cases which are due to medication or which are due to hormonal, homeopathy has its best shot. If you are experiencing PCOS, if you are experiencing hyper or hypothyroidism, if you are experiencing any sort of liver disturbances, any sort of gastric disturbances, if you are suffering from IBS where there is improper absorption leading into poor blood quality, all of these areas homeopathy can cover well, so that we can give medication for your main existent systemic disease and also for your hair fall, where there will be decrease in the hair fall, your hair will start growing and there is overall improvement. Remember, if you are suffering from gastritis or if you are suffering from IBS, there is no sort of proper cure in it in allopathy. But in homeopathy, if you are taking a lot of proton pump inhibitors, that is pantoprazole or rabdaprazole or esomeprazole, on a longer run there will be effect on the absorption rate. So by taking homeopathic pills, there is good absorption rate. Your iron problems, your selenium, your zinc problems through homeopathic supplementations, as well as your stress will be dealt holistically, and by giving proper medication we can deal with all of this. Apart from the genetic causes, we can deal with the other hormonal or the medicinal causes. If you are experiencing hair fall due to certain medications like arthritis, homeopathy has a best shot even in it. So try taking homeopathy for your hair fall if you're suffering from these kind of causes. Coming into the precautionary part, which is very important for hair fall issues. The first one is diet. What should you be taking in diet? See, remember, in diet you need all of these to be included. First one is carrot for your vitamin A, eggs for proper or holistic protein, and then you have oats, and then you have beans. Oats for fiber, and then you can replace oats with any other vegetable as well, and then beans for plant-based protein, and then green vegetables. Why do you need green vegetables? Remember, green vegetables have high amount of selenium, they have zinc, they have vitamin A also, and also these micro elements which are present in this green vegetables are very important to build your scalp health, to improve it, and also to form the hair properly and to increase the blood quality. You need berries to increase the blood quality, to have high amount of antioxidants. The berries have high amount of antioxidants in them, which will prevent the hair fall. Okay, that is the main thing in diet. Next thing is usage of hair products. If you're using a lot of hair products like hair mousse, you're using dry shampoos, you're using shampoos and then conditioners and then hairsprays, all of this, see, remember, all of these are chemicals, so they will tend to make your hair dry, brittle, breakage, and from there hair fall. And also remember, if you're having or dyeing your hair frequently, coloring your hair frequently, that can also affect the health of the hair as well as of the scalp. Hair care practices. If you're not oiling your hair properly, or if you're not taking any sort of care for your hair, that is either through diet or through external, you need light massages for your hair from the tips of your hand. You need that warmth. Okay, and also you need to do oiling your hair at least once a week, and then washing your hair properly using natural products. All of this will help in building your hair health. Next, stress management is very important. For example, if you're feeling very stressful and no matter what you do, you're not letting go of the stress, try taking a counseling session, because after taking a counseling session you might feel better. Try traveling to a different place, or a different town, or at least to your, to different villages, so that if you start traveling, that aura of what you're experiencing, that stress will decrease and you will start experiencing better health. And try to do medication as well as yoga for it. Medical conditions. If you're experiencing any sort of hormonal problems, remember, working out is very important, as working out will release hormones which are good for your health. Those are happy hormones, and those happy hormones will help in fighting this stress, and also will give you better hair. Lifestyle changes like including a lot of vegetables, a lot of protein. If you are suffering from iron deficiency, folate or vitamin B12 or D deficiency, maintaining that levels in your blood is also very important. Having a good lifestyle is very important for your hair health. What happens if you neglect the hair fall? Remember, hair is falling off not because of any other hair issues. If it is just because of hair products, or if it is of improper hair habits like pulling, tucking your hair, tying it in a high pony, or always putting it in bun, that can trigger hair fall. But remember, if you're having hair fall evenly, and if there is receding hairline and there is widening, these are the symptoms of something which is internal, that is systemic causes like hormonal. Many people experience hair fall with bad hairstyles, and when they stop it, the hair fall also stops. If it is not stopping even after these good hair practices, that means there is some sort of systemic disturbance inside your body. If that systemic disturbance is not corrected, there will be progression of hair loss, and there is no treatment for this medical condition. That can also lead into bad prognosis. It can have limited treatment option after it has gone to a certain level, and also it can psychologically impact, especially women. It can psychologically impact if you are having very bad scalp hair, or if you are experiencing hair loss. Try taking good lifestyle changes and also use medication as soon as possible. If you are experiencing hair fall, women especially on the scalp region, and you are having some hormonal issues or any other issues, then if you want to contact us, you can do it through two processes. One is the online consultation. You can contact us through audio and video consultation. And if you're staying nearby the nearest branch of Fidicus, you can come and contact us in person. After the doctor consultation, if you are having any sort of investigations, you can share it with us. If you need any more investigations, we will ask you to do it and share it with us. After all of this process, especially the online clients, we will be sending your medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And across the globe, anywhere, it can take 4 to 8 business days. If you are experiencing hair fall and you would like to take a doctor consultation, you can call us through this number, ping us or WhatsApp us or messages on this number. And if you'd like to know more about Fidicus Homeopathy, you can check out our website www.fidicus.com. If you are experiencing hair fall and if you want to choose a certain cure for your hair fall, why should you choose Fidicus Homeopathy? Remember, Fidicus Homeopathy stands for highest chance of health. Here we have three principles. First is we are dealing with patients with good success rate who are experiencing fair hair fall because of hormonal issues or because of allopathic medication side effects. Second thing, the transparent treatment. There is no gray area between the patient and the doctor. We will be explaining it to you, the process, the prognosis and everything. And also the personal care. If you're having any sort of myths or if you're having any sort of, queries regarding your hair fall, we will be educating you on that as well. So the personal care here at Fidicus is top notch. If you want to choose cure for your hair fall or if you want to decrease your hair fall, try choosing Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.